Welcome to today's webinar, 5 Common Myths and Facts about Oral Fluid Drug Testing for Government Agencies, presented by Bill Current of the Current Consulting Group and Jason St. Ors of Premier Biotech, with special guest Greg Straub from Michigan Department of Corrections. We are excited to share with you some information about today's sponsor. Premier Biotech is a leading provider of rapid oral fluid and urine drug testing solutions for criminal justice and corrections, for the workplace, health and human services, and clinical-based programs. Premier Biotech is backed by the company's CAP Forensic accredited and CLIA certified laboratory located in Minneapolis, Minnesota. And we kind of jumped through the slides a little bit quickly. We also wanted to let you know that should you be interested in continuing education credits from HRCI or from SHRM, those credits will be provided to you in a follow-up email, that information, so that you can apply for those credits. This presentation has pre-qualified for 1 continuing education credit hour for each of those organizations. And so we'll go ahead and we'll introduce to you a little bit more about today's presenters. As I mentioned before, today's presenters include Bill Current. Bill founded Current Consulting Group in 1998, and he's recognized as an expert in workplace drug testing. He's authored 11 books, including a 2026 release, What Every Employer Should Know About Marijuana. And he currently serves on the board of directors for INDASA, which is a drug and alcohol screening association. With us from Premier Biotech is Jason St. Ors. Jason is the Director of Government Sales at Premier Biotech, and he brings more than 25 years of experience working with government agencies, treatment organizations, and laboratory-based drug testing programs. He holds degrees from the University of Wisconsin-Madison and the University of St. Thomas. And our special guest today, as I mentioned before, is Greg Straub. Greg serves as the Assistant Deputy Director for the Michigan Department of Corrections. He is a purpose-driven leader focused on rehabilitation, restorative practices, and creating opportunities for second chances. Throughout his career, he has worked to strengthen staff culture, transform systems, and build environments where positive change is expected, ultimately helping create safer communities. And so with that, I'm going to turn the virtual microphone over to Bill Current to get us started on the content for this presentation.
Well, thank you, Jessica, and welcome everyone to today's webinar presentation. Before I leave the slide, I just want to thank Jason and Greg for being part of our presentation team today. And I'm just going to invite them both to jump in at any point. Greg and I are going to talk towards the end of the presentation more specifically, but at any point, if you want to jump in, please feel free to do it. Just unmute your mic and start talking, and we'll make room for you at any point. We're going to talk about the 5 common myths of oral fluid testing. You see them on the screen there, and then of course at the bottom you see we're going to talk with Greg more specifically. But as we go through the agenda, if you have any questions about the agenda items, anything we mentioned during the presentation, please feel free to put a question in the question section. We promise to get to all the questions. If not during today's live presentation, we will follow up and go through the questions in emails that we send out to you. So any questions that you have about drug testing, about oral fluid testing, about point of collection oral fluid testing, about Premier Biotech, etc., we're happy to answer those questions for you. And before I leave the slide also, well, I've got the Premier Biotech logo there up in the corner. I'm going to refer to a survey that we do every year at the Current Consulting Group. We just did our 28th annual drug testing industry survey. And as part of that survey every year, we ask questions about brand name recognition. So we'll ask the participants of the survey, name the top 3 brands in laboratory urine testing or laboratory oral fluid testing or point of collection rapid result oral fluid testing. And I have a slide on this a little bit later in the presentation, but I want to let you know that for the umpteenth year in a row, I've lost track, Premier Biotech is ranked as, or recognized, I should say, as the #1 recognized brand in rapid result or point of collection oral fluid testing. So congratulations to Premier Biotech for that distinction. We're going to start out with, we've got 3 survey questions, poll questions that we're going to pause and ask you during the presentation to get a little feel for where you're at with these issues. So we're going to start out with one right now, and I'll turn it back over to Jessica to take us through poll question number 1.
Thank you so much, Bill. So our first poll question, and we'll have a few during the presentation, so we invite you to participate with us. The first poll question is, how familiar is your agency with oral fluid testing? So I'm going to launch an interactive option for you to select answers here. So your options include: we currently use oral fluid testing, we are evaluating oral fluid testing, we have discussed it but taken no action, we are satisfied with our current understanding of oral fluid, and we are interested in learning more about oral fluid testing. And so please feel free, we'll give you just a few seconds to participate in this poll, and then we'll share the results with all of you. It looks like we're slowing down, so I'm going to end this poll, and I'm sharing the results with us. And so it looks like 78% of our participants say they are currently using oral fluid. 4% are evaluating oral fluid, 4% have discussed it but not taken action, 4% are satisfied, and 9% are interested in learning more. So I'll close this and turn it back to you, Bill.
Okay, thank you, Jessica, and thank you everyone for participating. Now, as it relates to what you just said in the poll question, as part of our annual survey of the drug testing industry, we asked, which screening methods do you currently offer? So these are drug testing companies. Which current methods which drug testing methods do you currently offer? And as you can see, 91% said lab-based urine testing, which is by far, the largest percentage. But I will say that that's down from about 96% 5 years ago. So we're seeing some encroachment from oral fluid testing in particular in that sort of block of providers who typically offer lab-based urine testing. And then if you go over to the light blue bar, 71% said lab-based oral fluid testing and 54% said point of collection oral fluid testing. Now, I mentioned that we've been doing this survey for many, many years, and those oral fluid percentages, and the hair testing percentage for that matter, used to be minuscule. There were just so few providers in the industry who offered alternatives to lab-based or point of collection urine testing. Now we're seeing dramatic increases to where we were 15 years ago, for example. And so then we asked the question, which drug testing methods do you anticipate offering in the future? And you can see just above the gray bar, which is sort of the miscellaneous category, point of collection oral fluid testing, 23%, and lab-based oral fluid testing, 22%. So a large percentage of, providers are already looking at offering oral fluid testing, either point of collection or lab-based. And this is interesting, right? Because it's a reflection of what the market is demanding, whether it's workplace drug testing or government agencies, et cetera. There's more of a movement toward oral fluid testing, just across the board. And so part of it is because many users of drug testing are using multiple testing methods now. So we asked the question, do you have customers who use more than one drug testing method? 42% said yes, we have customers who use urine, oral fluid, and hair. 23% said yes, urine and oral fluid, but not hair. And 13% said urine and hair, but not oral fluid. And then 1% said yes, oral fluid and hair, but not urine. That would be an unlikely combination. But that's where we're seeing a lot of the growth in the drug testing world right now, is toward oral fluid testing. And I've got some slides coming up that will speak to some of the reasons why that's the case. So let's get into our first myth. Is oral fluid testing as accurate as other testing methods? Okay. Now, in 2019, the federal government, the Substance Abuse and Mental Health Services Administration, put out a notification that it had finalized regulations for lab-based oral fluid testing within the federal government. So this is step one toward oral fluid testing. Step two, of course, would be the federal government of federal employees allowing point of collection oral fluid testing, although we see a lot of point of collection oral fluid testing in other areas like prisons and probation, parole, et cetera, at the federal level. They put out this statement, which I think is very telling. The scientific basis for the use of oral fluid as an alternative specimen for drug testing has now been broadly established, and the advances in the use of oral fluid in detecting drugs have made it possible for this alternative specimen to be used in federal programs with the same level of confidence that has been applied to the use of urine testing. So in 2019, SAMHSA came out with this statement as justification for why they were now allowing oral fluid testing. And it had to do, among other reasons, which I'll share with you, it had a lot to do with the fact that from a scientific basis, from an accuracy standpoint, oral fluid testing had been established and could be relied upon with the same level of confidence that users had been, applying to the use of urine testing in the past. Now, are oral fluid and urine tested similarly? Well, they are in many respects, right? So I've highlighted a few statements there in the 4 bullets that you have on the screen, right? There are some differences in the target of oral fluid and urine. For example, with oral fluid, we're typically identifying the parent drug or the drug itself, whereas with urine, we're typically identifying a metabolite of the drug. The biggest difference is that the parent drug becomes detectable in oral fluid within minutes after usage, whereas with the metabolite of the drug in urine, it takes 6-7 hours, maybe a little bit longer before the metabolite of the drug becomes detectable. So if you want to know if somebody's been using drugs very recently, then oral fluid testing is ideal because it identifies the parent drug, which becomes detectable in that oral fluid sample within minutes after usage. Now, there are differences between rapid and rapid and lab-based testing, whether oral fluid or urine. But with rapid test devices, they're using basically the same type of test strips with urine and oral fluid, very similar. And also that third bullet is very important, that a presumptive positive or a non-negative, depending on which terminology you prefer to use, with an oral fluid screen should be confirmed at a laboratory if possible, and when required by whatever laws or regulations apply to you, just like you would do with a urine test. So in other words, to be able to take some type of action based on the result, and you're using a point of collection test, if it's non-negative or appears to be positive, for example, you would want to confirm that. Now with OralTox, which is the brand from Premier Biotech, the result accuracy, as it says there in that 4th bullet, highly correlated with laboratory-based confirmation testing. So you're getting a very high quality, very legally defensible, reliable result with OralTox. Now, in the world of workplace drug testing, there are state drug testing laws that require employers who want to use point of collection oral fluid testing to use an FDA cleared device, a device that's been cleared by the Food and Drug Administration. OralTox is the only device on the market. And Jason, correct me if I'm wrong, but I believe it's the only FDA cleared device on the market right now. Does that sound right?
Yep. And one thing I'd add, Bill, is that we're seeing a rapid adoption of oral fluid tests due to the ability to test for more substances now. So in the past, you've been stuck with kind of the standard drugs like THC, cocaine, opiates. But recently, we've been able, we're the first ones to come out with the fentanyl strip in our OralTox test. So things that allow you to have a more relevant panel to deal with the substances that are on the street and now available in oral fluid. I think that's been a big game changer in bringing, oral fluid to the marketplace and have that adoption.
Yeah, and that's a great point to make because, traditionally, as Jason mentioned, it's really been sort of marijuana, cocaine, heroin, amphetamines, and phencyclidine or PCP. And so if you look at the drug test results from one of the major laboratories in the drug testing industry, and you compare the positivity rates by drug with urine compared to oral fluid testing, you see that there are some differences, but the little note box on the side there points out that they did not release the results of barbiturates, benzodiazepines, and fentanyl, which are drugs that are commonly abused. And as Jason mentioned, fentanyl being primary among them. So, but this is interesting to look at these, right? So the positivity rate for amphetamines between urine and oral fluid testing, very similar, right? 1.7 to 1.2. You see a little bit of a bigger difference in the positivity rate for cocaine under oral fluid, but the real difference maker is the positivity rate for oral fluid with marijuana compared to urine, 10.4% versus 4.5%. So with marijuana being the #1 substance of abuse, the drug that is most likely to trigger a positive result, you're going to get more positives with marijuana, with oral fluid testing when testing for marijuana. And part of that, there's other reasons, and Jason, feel free to jump in, but part of the reason for that is that ability to detect very recent drug use. And so when somebody comes in, they get tested, they test positive for THC, it's very likely that they tested or that they used the drug just within hours, maybe sooner than that. And in your world, that's important to you for a number of reasons. You don't need me to tell you why. But in the workplace world, it's very important because we're talking about people impaired on the job and possibly performing safety sensitive functions. The employers want to know, has that person been using drugs recently and is possibly impaired on the job because of that drug use? With oral fluid testing, you're going to get a higher percentage of positives for THC than you will with urine.
It's been super helpful, Bill, in in the agencies, the child and family service agencies that we work with, where they're out in the field. They need to test parents that are obligated to test negative to maintain custody of their children, and they can do that right at the doorway. They don't have to lock down a bathroom out in the field. And if it does show a positive, that child might be at risk, and they can take action if they need to. So it's a great tool for a situation like that, and that's been something that we've seen oral fluid be really effective at.
Yeah, and let me add that you're going to get the recording of today's presentation, so don't try to take notes real fast. You'll have this chart to look at in more detail a little bit later. But let's move on to myth number 2, which is, can marijuana be detected through oral fluid testing? We sort of dealt with that, right? So the answer, of course, is yes. There are over 2 decades worth of studies, reports, peer-reviewed journals and publications that bear this out. So I would say back in the early days, I started the Current Consulting Group 28 years ago. Back in the early days, there were a lot of myths about oral fluid testing. One of them is that you couldn't detect THC in oral fluid testing. That's not true. And especially in today's world of drug testing, the science and the technology has advanced so significantly that you're actually getting more positives for THC in oral fluid than you are with urine. Part of that, of course, as I mentioned, is the window of detection. We'll talk about that in a minute. But also, look at that third bullet there. Detection rates vary for lab-based testing versus instant testing due to cutoff levels. And so with instant testing, you're going to typically have a higher cutoff level, leading to better discrimination around recent use. And that question, Jason, must come up, right? Because Premier Biotech offers both lab-based and point-of-collection oral fluid testing.
Yes, it does, and it's important that the testing is correct, and so the higher cutoff better differentiates whether somebody's under the influence, bouncing off the walls, that type of situation. So yeah, the sensitivity in the laboratory is quite a bit better, and we use the best at liquid chromatography for our confirmation testing. That gets very low.
So let's look at marijuana specifically over a 5-year period from that laboratory that I mentioned earlier. You can see the positivity rate compared to other drugs is much higher, peaking at 14.8% in 2021, dropping down a little bit, but still in double digits at 10.4% in 2024. And I should mention that this 2024 result that you're seeing on the screen is from the 2025 report that the laboratory put out. So it's the latest information that's available, but it still shows a significantly higher positivity rate for marijuana, and it's consistent over the years. Now, I did ask the laboratory why there was such a drop from 14.8 to 10.4, and they said it had to do with a drop in the volume of oral fluid testing by one company. Not that the company stopped doing oral fluid testing, they just started doing it with a different laboratory. But the percentage is still significant, and you can see that it's consistently significant, significantly higher than other testing methods and for other drugs. So let's talk now about the window of detection. We've got this nice chart here on the right for you. I want to explain this real quickly, right? So you see blood is the red line, oral fluid the blue, urine the yellow, and then off to the right, hair is the brown one. And so you see that with blood and oral fluid testing, the window of detection starts right there at the beginning of the window, right? So as soon as somebody uses it, within minutes, the drug is detectable. the parent drug becomes detectable within minutes in both blood and oral fluid. Also with breath, although the technology with breathalyzers is still very, very new, and we don't have a rapid breath test yet that can reliably identify marijuana or THC use and not other drugs at all. So mostly we're looking at oral fluid testing, possibly blood testing if you want that very, very recent use detection capability. With urine, as I mentioned, it's slightly over to the right. That's because it takes 6-7 hours before the metabolite becomes detectable. But the window of detection goes out fairly long with urine and hair. So if you're looking at lifestyle usage, you may want to look at hair or urine. But if you're looking at right now, when somebody comes in, do they have drugs in their system? With oral fluid testing, you're going to get a much more accurate reflection of whether they've used drugs very recently and whether they have drugs in their system at the time of the test. And I'm going to kind of breeze through a couple of these. There's some really good information on this slide, right? The oral fluid detects recent drug use better than urine and hair. I kind of touched on that, but I want to point you to this slide, but I want to move over to the next slide very quickly. But let me point out two things. One, on the second bullet, identifying recent drug use is critical in situations where drug use is suspected, as it may indicate a possible link to impairment or violations of court orders, etc. And then go down to the fourth bullet. This can also apply to any number of government testing scenarios where the ability to detect recent use, like if it was the workplace with pre-employment, it would indicate that the person is unable to abstain from using drugs long enough to pass a job interview where they know they're going to be tested. This can be applied in a number of government testing scenarios as well. Now, keeping that in mind, let me just show you this chart, and we won't go through all of this because it's a lot of information. But if you compare urine, oral fluid, and hair testing in these main categories that are in the left-hand column, whether it's lab-based or rapid, scientifically accepted, what the window of detection is, you can see that's a significant difference between urine, oral fluid, and hair. The value of recent use detection, whether or not you can detect parent THC, very important, possible with oral fluid, not really possible with urine or hair. The legal status by state, and that depends on the market that you're in, and whether or not there are SAMHSA regulations or federal regulations for that testing method. There are for urine, of course. There are now, over the last 5 years, for oral fluid, there are proposed regulations for hair. This is just sort of very general, right? Because let me give you an example. On the window of detection, it might vary significantly depending on the drug that we're talking about. So for example, under oral fluid window of detection, we've got an asterisk there at the end of the statement. Then you go to the box and you'll see that typically the same for rapid oral fluid tests except marijuana, which is shorter at about 6 to 10 hours. Does that ring true there with oral tox, Jason?
Yes, it does. That's correct.
Okay. And that could be very important to you depending on why you're testing, who's being tested, what the consequences would be for testing positive, etc. Now, we track the laws here at the Current Consulting Group. We provide all that information to Premier Biotech, but are government agencies permitted to use oral fluid testing? So here's an important factor to keep in mind. There is no one law in all of the United States that covers drug testing, whether it's in the workplace market or the government market or treatment or insurance testing, which is also a big market for drug testing. It's usually dependent on the individual states or counties, government agencies that are involved, right? So that could vary, and you could be listening to this presentation, hear me say it's allowed here, it's allowed there, and think to yourself, well, I'm not sure it's allowed where I do business or where I'm trying to conduct drug tests. That could be. So if you have questions like that, send them in and we'll look that up for you, specifically for government testing, okay? Most state drug testing laws are very specific to the workplace. They could mention other types of testing, other markets for testing, like probation, parole, family court, drug court, etc. They sometimes do, but almost all of them, to my knowledge anyways, and we track these laws very carefully on a week-to-week basis, they specifically mention the workplace, employment testing, etc. Now, that could apply to you if you're testing your employees as well as the people that are in your programs, right? So that could apply to you. But even then, it might be a little bit different because you're a government agency. So if you have specific questions, let us know. We'll look it up and give you a very specific answer, okay? And so if you look at that second bullet, most state laws are adding restrictions on conducting drug testing without strong indication of impairment. That's because of the legalization of marijuana in so many states, where there's a movement toward protecting the rights of the marijuana user, particularly if they're in some type of a medical marijuana program in the state. They're a registered medical marijuana user. And so for workplace testing, for example, you'll see a lot of this kind of language where, in addition to a positive test result, an employer would have to show some evidence of impairment before they could take any kind of adverse employment action. The advantage with oral fluid testing in these situations is that tighter window of detection that provides this strong correlation to recent use, which may correlate to signs of impairment in a workplace situation or a violation of some type of court order, et cetera, in a government testing situation. So we know that oral fluid testing has been approved by the federal government for federal programs. We also know that it's been approved for Department of Transportation drug testing. That's still in the works of being finalized. But the federal government has been going in the direction of oral fluid testing now for the past 6-7 years. Interestingly, this might be on a slide that's coming up, but I'll say it now. There have been some states that have passed laws that prevent employers from using a drug testing method that is only capable of revealing the presence of metabolites of marijuana. California and Washington are two examples that come to mind, meaning you can only use, if you want to test for marijuana and be able to take action based on a positive for marijuana, you want to be able to use a testing method that detects the parent drug, or in this case, oral fluid testing. But all of what you're hearing from the federal government about oral fluid testing just adds to the growing evidence of credibility for both lab-based and point of collection oral fluid testing. And that's why I think you're starting to see significant growth, in addition to some of the advantages of oral fluid testing. And the laboratories that perform the confirmation testing, or if you're sending in for the screen as well, you're seeing more laboratories being certified to conduct oral fluid testing, which also adds to the credibility of oral fluid testing as an alternative. Maybe not as a replacement for urine testing, right? Because one of the slides we looked at earlier showed that a lot of organizations are using a combination of maybe urine, oral fluid, and hair, but that they have that option available, and that there are labs that have been certified to test for oral fluid testing as a confirmation test is a significant development in our industry. Anything on that, Jason, from Premier Biotech's perspective?
Yeah, I would say that we're just seeing more and more people want to dip their toes into oral fluid testing. In our space on the government side, it's still probably 50-50 urine versus oral fluid. And so you'll have issues with people having a shy bladder. They'll have a staffing situation where, a lot of cases, there's a lot of ladies on staff and a lot of males that are in the agency. And so it's hard to lock down a bathroom and do an observed collection. So they'll try out a box or two of an oral fluid test and, see how that works. And then they see the advantages of it, not only because, it's easy to use, you can do it anytime, anywhere, it's 100% observed. You don't have that staffing situation, that it's becoming more and more of something that's a great tool for them and maybe a better solution than urine. Does that make sense, Bill?
Yeah, it does. And that leads nicely into this slide, where we're seeing government agencies across the country increasingly using oral fluid testing. So you said, Jason, it's basically kind of 50-50 still. But if we went back, say 10 years, the percentage would have been much more lopsided toward urine testing, right?
Yeah, for sure. 75, 35, 25, something like that.
Yeah. And I'm really interested in hearing Greg's perspective when we get to that in just a few more slides, because he's actually done it. He's adopted oral fluid testing in many situations there in the Michigan Department of Corrections. So we'll get to that in a minute. But these next two slides are just a couple of slides you can look at your leisure. but they have to do with what SAMHSA said was their justification for allowing oral fluid testing or developing regulations for oral fluid testing: enhanced flexibility, versatility, decreased invalid tests, which can add quite a bit to the cost of drug testing. It just saves time and it's versatile. Now, when DOT adopted their final regulations, they were very specific. They adopted oral fluid testing because of the drug test cheating situation. It's very, very difficult to cheat on an oral fluid test when every collection is 100% observed. So that just makes it very, very difficult for somebody to get away with that, doing that. And also, you don't have the, it's a gender neutral type of test. You don't have to align the gender of the collector with the donor, because we're not using bathrooms, we're not securing toilet areas or hot water or putting blue dye in the toilet or anything like that. So these were among the reasons why the federal government decided to adopt oral fluid testing and finalize regulations. So with that, Jessica, let's go to poll question number 2.
Excellent. All right. So our next poll question is, what is your agency's biggest question regarding oral fluid testing? So we have these options here. I'm going to go ahead and launch the interactive part of our poll. Accuracy and reliability, court admissibility, marijuana detection, cost, or we have no significant concerns about oral fluid testing. So I'll just give you all a little bit of time to voice your opinion or experience. And we were slowing down, but we got an uptick. Okay, I'm going to go ahead and share the results now. So we have 55% said that their biggest question regarding oral fluid testing is accuracy and reliability. 3% said court admissibility. No one said marijuana detection. 27% said cost, and 15% said we have no significant concerns. So back to you, Bill.
Now, before we go on to the next slide, Jason, we've really addressed the issue of accuracy, which was 55%. 27% mentioned cost. How would you respond to that?
Well, I would say cost is getting to be very similar to urine. It obviously depends on what your panel configuration looks like and the substances that you're testing for. But I'd love to have a conversation if someone's interested in oral fluid or trying out some of our tests. Love for them to reach out, and we can get you some better information on pricing, maybe get some samples and some information about our laboratory.
Yeah, we've done some return on investment calculations for oral fluid testing compared to urine testing. And you have to factor in as well, not just the hard costs of the test itself, but the soft dollars that are involved in the time that you save with an oral fluid test compared to other testing methods. So when you add it all up, typically an oral fluid test will produce a pretty attractive return on investment for the organization that's using it.
To add to that, Bill, we've had a lot of organizations that have been using a urine collection site network where they've had their folks go down to a collection site and somebody will collect a urine sample, send it off to a lab and do the analysis. And that cost is significantly higher than oral fluid and urine-based testing in the agency. However, oral fluid you can do anytime, anywhere. So the gender situation allows you to do a quick collection, send it off to the lab, or get the instant result with an oral tox type test. And it just makes, to your point, the cost-effective nature of oral fluid much, much greater.
Yeah, and that's a significant issue to bring up because we are seeing companies in the workplace market, government agencies being pinched a little bit on their budgets and looking for ways to reduce costs. This makes it possible. Oral fluid testing makes it possible to continue testing at basically the same volumes as you've always tested at, if not more, and actually come out ahead cost-wise. So, but Jason would love to talk to you about that in greater detail. Part of the reason why you see such a cost savings is the collection process, which is much easier with oral fluid testing. Now, I've been in the drug testing world for 30-something years, And I'm a fan of drug testing. I believe in it. I think it works. I think it helps identify people who need help. But also, it's there to protect the integrity of the workplace or the court or whatever government agency we're talking about. And you want a process that is smooth, it's easy to do. And look at that fourth bullet there. It protects the dignity of the donor. This is becoming such a big issue in the world of drug testing. I just came back from a drug testing conference a few weeks ago, and that was a big topic of discussion at this conference. The dignity of the donor in the testing process. It's just becoming a higher and higher priority for the organizations that are conducting drug testing. But with oral fluid collections, basically it can take place anytime, virtually anywhere. It reduces the wait time. It virtually eliminates any cheating issues. And as I mentioned before, that third bullet, the collections are gender neutral. So it eliminates any issues with observed collections, which also eliminates drug test cheating efforts, because most of the things that somebody might try to do to cheat on a urine test are just not applicable with an oral fluid test. And so 100% observed, nearly impossible to adulterate or substitute or tamper with the sample, as you see in that first bullet there. Not subject to dilution, like with urine, so that goes away. But then the fourth bullet, reducing drug test cheating, identifies those who maybe are trying to beat the test and subvert the system, which essentially reveals a problem that exists there, right? So a lot of good information here. I just want to get through these next couple of slides real quickly so we can get to Greg's part. But I want to point out the third bullet here. A growing area of interest in the world of drug testing are what we call remote video observed collections, or proctored testing. So a collection that can take place by video observation while the individual is in one location, the collector or observer is somewhere else. That's becoming a thing, which is possible with oral fluid testing, not really possible with urine testing, but that's a growing area of interest in the world of drug testing. We're seeing that growth there, and oral fluid testing is the thing that makes that possible. And then the other thing is that sometimes when somebody knows they're going to be drug tested, but they don't necessarily know it's going to be an oral fluid test, they've come prepared to maybe try to subvert the urine test. And then when they find out that it's an oral fluid test, they simply confess that they've got drugs in their system, and they sort of self-identify or self-eliminate from the testing process. Oral fluid testing makes that possible because you just can't cheat on an oral fluid test in any kind of meaningful, consistent way. It's just not possible. Now, in conclusion to this section of our presentation, and then we're going to get to Greg. In our 2026 drug testing industry survey, we asked those questions about brand name recognition. And I mentioned that Premier Biotech always ranks at the top, and they have for many, many years now. But just to give you an idea of how far out ahead they are of the competition, Premier Biotech, in our most recent one, which came out back in, let's see, where are we? June, it came out the beginning of May or the end of April at the conference. Premier Biotech had 238, and the closest competition was at 131. And so this is not unusual to see this gap between number one and number two, but this was, I think, the largest gap that we've ever seen. So the brand is growing. It's the number one recognized brand among drug testing professionals, and that says a lot to the to the value of using a product that's FDA cleared, if that's important to you. A company that has both lab-based and point of collection testing, and that's been around for a long, long time, with a large presence in the government market for drug testing. So one more poll question, and then we will get to Greg Straub. Go ahead, Jessica.
All right. So this last question is, what advantages of oral fluid testing are most valuable to your agency? So we'll go ahead and launch this poll. These are some topics that have been discussed today on our presentation. So where's the value? 100% observed collections reducing cheating and adulteration, gender neutral collections, detection of recent drug use, easier logistics and scheduling, on-site testing capability. And so I'll be quiet for a second while you all participate. Okay, it looks like we're ready to share the results. And we have 46% said 100% observed collection reducing cheating and adulteration, 61% gender neutral collections, 36% detection of recent drug use, 18% easier logistics and scheduling, 32% on-site testing capabilities.
Wow, those are some pretty strong percentages. 61% said gender neutral collections. That's pretty impressive. 46%, 100% observed collections. So, Jason, there's some good information to tuck away for the next time you're talking to government agencies.
That's great.
Yeah.
That's what I expected, though.
So let's now introduce Greg Straub into our conversation. Greg is the Assistant Deputy Director and Field Operations Administration for the Michigan Department of Corrections. Greg and I were talking beforehand. And Greg, tell our audience just a little bit about your background and the responsibilities that you have at the Michigan Department of Corrections.
Sure. Thanks, Bill. I appreciate it. And thanks, Jason, for getting me on this call. I think it's it's a great topic if you're in our business of supervising individuals in the community who have a substance use disorder. So this is a great conversation. I really appreciate it. So thanks, Bill. So my background is all in field operations with the Michigan Department of Corrections. Right now, in my current position, I'm Assistant Deputy Director, but previously for 20 some years, I rose to the ranks of a probation and parole agent, a parole supervisor. I ran the parole board all the way up to the Assistant Deputy Director. So right now in Michigan, there's 83 counties, and I'm responsible for 74 of those counties' parole and probation offices, and all the staff within those offices.
How in the world do you stay on top of 74
I cross
counties?
my fingers quite a bit, Bill. I cross my fingers quite a bit. No, I mean, I think we have built a culture in the Michigan Department of Corrections. For those of you who know Michigan and what we do here, we are a national leader when it comes to field operations and community supervision. We follow the evidence and we do what's right, and drug testing is no different for us when it comes to following the evidence and the research and doing what that tells us we should do. But yeah, as far as staying on top of that many people, I got a lot of good staff that work here and who really want to help people be better people.
I didn't discuss asking you this question earlier, Greg, but in our conversation, you said something that really impressed me, which is that at the end of the day, you go home feeling like you've done something really purposeful and worthwhile. Yeah. We often talk about how drug testing really is intended to help people, and you must see a lot of that in what you do.
Yeah, no, I appreciate you saying that, because drug testing to us isn't a punitive thing per se. It's not to catch you and say, see, you're still a bad person. It's really to help people. And we come at this from more of a coaching philosophy than a referee model, where we just wait for people to screw up and we blow the whistle on them and throw penalty flags. We come at it from a coaching perspective of wanting to help people be better, build their skills, change behavior, rooting for people to win. And that's where we come at this drug testing thing from.
That sounds great. Great. So tell us a little bit about your drug testing program and where rapid oral fluid and oral tox fit into it.
Yeah. So, this has really been a game changer for us, the oral tox. We have been with Premier since 2017, and prior to COVID, I would say COVID really changed the game for us in a lot of ways. And I'm sure a lot of the people on this call have felt a similar experience, where prior to 2020, we were pretty much, and Jason can attest to this, I think, we were pretty much exclusively a urine state organization, where we purchased just urine cups and we tested that way. And 2020 kind of changed the game, where we couldn't be around people and we had to figure out a different way. And Premier really did a really good job in helping not only us, but I think this way of testing during that time to make sure we were still doing our jobs and we were able to do our jobs. We found, since moving to the oral test, that speaking of money and saving money, we used to hire people. We called them urine monitors. We used to hire people in our field offices to watch people go to the bathroom, make sure they weren't adulterating their things. And that was their job. Literally, that was their job. And since moving over to this, we've actually got rid of all of those positions, and which is, saved us money. And for the gender neutral situation, we're in the field. I mean, we have field agents. That's what they're called, field agents. So they're in the field constantly. And when you have a female going to a male's house to do, a home visit and to see how they're doing, you couldn't do a drug test. You had to wait for the person to come into the office, which we know inconveniences people. Like, people have lives, they have children, they have jobs, they have other things going on than probation and parole. And to have somebody come in an extra time just because we can't do a test at their house when we're there is an inconvenience. And I think when you start talking about setting people up for failure, we're going along those lines of having people come in and leave their jobs, leave their families, leave their kids. And this has really helped with that. We can have female agents go to a male client's house and drug test them, and vice versa. So it's really changed the game for us quite a bit.
So what are some of the attributes of rapid oral fluid testing and oral talk specifically that have been an advantage or helpful to you?
Well, what I mentioned as far as the females testing males, males testing female clients, the field work alone has been significant in getting agents out in the field to be able to do the jobs and not having people in our offices all the time. Like I said, getting the urine monitors, who basically were just there to monitor someone to test. I mean, we've moved to a panel where we want to focus here on the drugs that are driving the crime, right? I mean, there's some serious drugs out there. Fentanyl, methamphetamines is a huge driver of crime in communities, and with Premier, we've created a panel. I think that, and I don't know, Jason, if you could. I may be making this up, but I think it really is a national leader in panels when it comes to what we're focusing on to make sure that we're helping people get better, so they're not committing those crimes because of a substance use disorder, right? I mean, Jason, am I wrong in that?
Yeah, Greg, I totally agree with that. You're focusing on the hard drugs that are causing issues in the communities, and I'm a super fan of what you guys decided to do, and we've helped partner with you, but I think it's mostly you guys trying to putting that panel together. But great point.
So I'm not sure that's your question, Bill, but I hope it does.
Go ahead, Greg, please.
No, I'm not sure that answers your question, but I hope it does.
I missed that, Greg. Sorry.
No, I said I hope that answers your question. I'm not sure if I hit you.
Oh, yeah.
Topic. Okay.
No, yeah. I mean, you and your people are administering drug tests virtually every day, I would imagine, right? This is a big part of the job.
Well, I can tell you, well, here's our system. In Michigan, we have a unified system, which means we are responsible, Michigan Department of Corrections is responsible for all the parole in the state, all the circuit court probation in the state, the parole board, and the prison facilities. So we are a unified system, and we're responsible for all of that. So just in field operations, we supervise 32,000 people on probation and 9,000 people on parole. So we supervise about 40,000 people in Michigan on community supervision, which is a pretty significant amount. It's not small, it's not California, but it's a pretty significant amount. And we ordered, I think, 100,000 drug tests last year. And a very small percentage of that is urine test. I think 4% of that was urine test.
Wow. That's
so yes, we do a lot of tests.
Yeah. And, I've always contended that drug testing is, like you said, it's not intended to be punitive. It's to identify people that need help or to help people have that extra motivation to abstain from using drugs. And when they know they can't cheat on a drug test, which is a common problem with urine. Urine has its strengths, of course, but it's a much more feasible possibility with urine than it is with oral fluid. And that makes a big difference in terms of the deterrent value of the drug test itself.
Yeah, no, when we first moved over to this in 2020, it's been over 6 years now. We heard the complaints about, I feel like we're not getting the results, the positives. We're not in, I think people are adulterating these things. And Jason can tell you, I think, saliva, I think regenerates like every 10 minutes. Is that right, Jason? Ish?
Yes, correct. Yep.
Okay. So we tell people, if you think that's happening, somebody puts something in their mouth, do the visit, talk to somebody for 10 minutes, and then give them the test. And that way you're for sure that they're not adulterating the sample or having something in their mouth, because it's going to regenerate every 10 minutes. So you're good there. And I think, I think it's a much cleaner, better, easier test than others.
I mean, to that point, Greg, I feel like every day I have somebody telling me how they hate watching people pee in a cup. And so, that's one of the great things about oral fluid is that if you're a caseworker, if you're a field agent, if you're a drug court coordinator, you're trying to develop rapport with your client. And then, at the end of the meeting, you say, let's go to the bathroom, I gotta watch you pee in a cup. That wrecks the whole kind of development of a relationship. Can you maybe speak to that? Is that something that, oral fluid has helped you out with?
Well, I mean, you said it, right? When I say cleaner, that's exactly right. Like, when I got in this business, I got in the business to help people and to connect with people and to really try to change the trajectory of lives, right? And it wasn't to, watch somebody urinate in a cup and then handle that and drop things in it. And it was like, this doesn't feel right, right? I mean, it's just, so since the move over, just to give somebody a swab and say, here, throw this in your mouth for a few minutes. You can sit in the lobby here while we wait, and I can talk to other people. It's been a game changer for me. And again, I'm not selling anything. I'm just telling you from our perspective of facts of, we've been with Premier since 2017. We were exclusively pretty much urine cups, and then we moved to these. And I think the oral tests are just so much better. Just from again, like the cleaner perspective, like you say. I don't have to go to a bathroom and watch somebody, and it's not the most cleanly thing to do, and it's not comfortable when you just had a good conversation with somebody about their life. To now we can just say, here, just swab your mouth for a second, let it sit in there for a second, and we'll get your drug test and get you out of here. It's much, you can keep that connection with somebody and that rapport. Yes.
So we've got Greg here, we've got Jason here. Jessica, let's turn to some questions from our audience now and go through a few of those. And I have another question for Greg that if we have time for, I'll use at the end. But let's entertain some questions from our attendees today.
Okay, I have a question. It has a little bit of a lead up to the question, so bear with me just a minute. It says, in our experience with oral samples, we've seen a higher rate of false positives. The benefits of oral testing, particularly related to trauma-informed treatment responses, are undeniable, but the higher rate of false positives gives our organization unease when using oral screens. Is the technology of oral testing improving to help eliminate the concerns for false positives?
Jason, you want to go first?
Sure. Every situation is a little bit different, so I'd love to hear the particulars of what, why you're getting a false positive and what you're doing for the confirmation at the laboratory. Oftentimes that can be the issue. The instant test might be testing for more things than the lab or vice versa. So I'd love to have a conversation with you about that, if that might be possible. But to the question about the technology, we're on our third iteration of our rapid oral fluid test, oral tox. We've been making it better and better. We've been lowering the cutoffs as much as we can, and when it makes sense, as much as possible, to try to have them align as much in the laboratory. We use the LC mass spec confirmation testing in the laboratories, which is the best method for this type of testing. It gets very, very low. It's super fast. We've got, we can get a result back to you, which is important for people. But I think the technology's gotten much, much better over the past couple of years to eliminate a false positive situation. Back in the 80s when these came out, early 90s, some of them were not the best tests, and they've continued with a bad reputation since then. So that's part of the reason we wanted to put this webinar out, is to try to get the word out that the technology's gotten much better, and we're big advocates of it for all the reasons we've discussed today.
And I think it also goes back to that statement from the federal government, that the reliability of oral fluid testing has gotten to the point now where the results are, exactly comparable to the results you would get with urine testing. So, but a lot does depend on the device you're using, the lab you're using, the process that's involved in that. So I would, if you really do have a concern there, but you like all the other advantages of oral fluid testing, I would definitely advise you to have a follow-up conversation with Jason and go through some of those specific concerns and let him address those for you. Next, Jessica.
That is, let's see. I have another question. Okay, here I have a couple others. This question says, we only send our tests for laboratory testing, no rapid testing. We often hear from participants that they tested negative on a urine test, but positive on our test. How do we handle these types of situations?
I'm not sure I understood that question. Jason, did you understand? Are you talking about the difference between a lab-based test and a rapid test, or a urine test and an oral fluid test? What was?
Go ahead, Jason.
It sounded to me like the difference between an oral fluid test and a urine test and a detection window situation. So, oral fluid typically is, up to about 2 days of detection. But to Bill's point earlier, you pick up things, right off the bat. If somebody's, obviously high and bouncing off the walls, you're apt to pick that up on an oral fluid test. Whereas in urine, it takes 6 hours or so to get through the body into the urine. But you get an extra day or so at the back end. So, you can have a positive on one test and a negative on the other, and they can still be both right just because of the different, matrices or different urine versus oral fluid. So sometimes, a lot of times, that's the actual issue, is that, you're right at a window where one might show negative and one might show positive. I'm not sure if that answers the question.
But now that I understand the question, that is a good question to ask. So a lot of it goes back to, what is your objective? Do you want to identify people who have used drugs recently and have drugs in their system when you test them? In that case, you want to use oral fluid testing. You're going to get that immediate drug use detection with oral fluid testing because you're detecting the parent drug. And as Jason mentioned, it takes several hours before the drug goes through the body, metabolizes, and the metabolite becomes detectable in a urine sample. And even longer with hair. We're talking 7 to 10 days before a drug becomes detectable in a hair sample. Now, if we're talking about chronic users that are using every day, multiple times a day, then it's going to be in their hair, all the time. But if you're looking for recent use detection, somebody used just before they came into the office or whatever or just before you showed up at their home, et cetera, then oral fluid testing is the test that will fulfill that objective. And Jessica, if we're out of time, I just had one more question for Greg, if we have time.
Go ahead.
Okay, so Greg, so unique to have you here, and thank you very much for making the time to be part of this presentation today. We know you're busy, and I'm sure this is a topic that's near and dear to your heart. But for those people out there in today's presentation who maybe have been reluctant to switch or maybe add another drug testing method to what they've been historically doing, what would be your best advice for them?
Well, I guess it's just what are they looking for as far as convenience and as far as having field agents be in the field doing the work. This makes it easier. It just does. It's you look at the gender neutralness of this of oral testing, and you don't have to have people going back and forth or having other staff help out while because they need a male, they need a female to do a test. And when they're in the field, they can take the test while they do their interaction. It's just really what you want. And as far as I hear a lot, I don't know the reliability and the false positives. We hear that too here, and I guess it just matters again how you want to use test. We use them in a treatment way, right? We want to see where people are at. We want to see when they're in treatment, are they moving forward? Are they progressing? And if not, where can we help differently? I really believe that you cannot incarcerate addiction out of people. So it matters to know where people are. And, some people have shame in using drugs, and testing helps us get through some of that and open up and move forward. So, these tests have really freed up our staff to do the job the way it should be done and not have to pause and say, wait a minute, I got to find somebody to go test you, or I got to have you go over here or come to my office tomorrow because I got to test you. It's really freed up our agents to do the job that they should be doing.
That's great. Thank you, Greg, for that. Anything to add, Jason? I know we're right up against the top of the hour here.
No, that's great. Appreciate you guys. Thanks for being on, Greg. Really appreciate those. Great testimonial.
Yeah, thank you very much, both of you. Jessica, let me turn it back over to you.
Excellent. Thank you to all of our presenters today, Greg, Jason, Bill. Thank you for your experiences and your expertise. We did have a couple more questions that were coming in here as we were finishing up. For those of you who submitted those questions, we will send you those answers offline. So don't worry, we will give you responses. And we'd like to thank you all for joining us today. And we hope that you found today's presentation to be informative and helpful. This presentation was recorded and you will receive instructions informing you how to access the recording via email, as well as if you have qualified for the continuing education credits from SHRM and HRCI. Those credit IDs will also be sent to those who have qualified by attending the entire 1 hour live presentation. If you have any questions in the future about this, we have information for how you can get a hold of Premier Biotech, and they can help direct you either back to us at Current Consulting Group or to help you with your drug testing programs wherever you may be. And so with that, we conclude today's webinar presentation. We hope you have a wonderful day.